This is Dr. Rakesh Boppana, consultant endocrinologist. Today we'll be discussing in brief about diabetes. So this is one of the global problem, and even the same with the South Asian countries and especially India. We are leading in the numbers zone with increasing diabetes numbers day by day. So today's topic would be about diabetes and how to manage it. A person is labeled diabetes on three parameters. So one is fasting blood glucose, postprandial blood glucose, and HbA1c. So what is fasting plasma blood glucose? So this is taken when a person is on a fasting, on an empty stomach early morning on a 10-hour fast. When we take the sample, if the blood glucose values come more than 126, then it is called in the diabetic range. The same way, postprandial blood glucose levels, when these comes more than 200, so this is called diabetes. Or in the same way, HbA1c, a 3-month average, which is more than 6.5, is labeled as diabetes. So either of these, any one of these coming on the higher side, we usually label them as diabetic, and then we have to start managing the blood glucose values. There are like 14-15 types of diabetes, but out of them, the most common types of diabetes are type 1 and type 2. Out of them, type 2 is much more common. It is mainly seen in adult population. This is basically insulin resistance. So there is certain resistance to the function of insulin, which is a hormone in the body. So that is the reason why these sugars shoot up in these population. So then coming to type 1, which is the second most popular type of diabetes. Here the problem is the autoimmune disease. So wherein body's immune cells destroy the body's pancreatic beta cells, wherein the insulin cells are completely destroyed. So this leads to type 1 diabetes with absolute insulin deficiency. These people require insulin from the day one. This is type 1. So apart from these two, the other most common type of diabetes is the gestational diabetes, which is seen in pregnant women, usually post 24 to 28 weeks. So this is called gestational diabetes. The management is little different compared to type 1 and type 2 gestational diabetes. Apart from these, there are MODI and then LADA and other forms of diabetes, pancreatic diabetes, which are very, very rare in nature. Common causes of diabetes, we'll put it into two categories, one type 1 and the remaining type 2. So in type 1, as we already said, it's an autoimmune wherein pancreatic beta cells are getting destroyed by the body's immune cells. So this is an autoimmune in pathology. So this is clearly known. So coming to type 2, which is most common form of diabetes seen in the adult population, or young adults, we could say. The reason here is multifactorial. We have multiple reasons for diabetes. One is genetics, one is lifestyle, one is environmental factors, multiple things. So genetically, because parents are type 2 diabetic, the next generation definitely has a increased risk of developing diabetes. That doesn't mean they will definitely develop, but there is an increased risk of developing diabetes. Secondly, overweight, obesity. So when there is overweight and obesity, there is a natural tendency for the body to have an insulin resistance. So this will aggravate the underlying pathology and then lead to type 2 diabetes at a later date. Then the third would be exercise, and then lethargy and overeating. All these things do matter a lot. Type 1 is especially seen in younger populations, say first 10 years of life till early years of the second decade. So here the sugars will be very high, 400, 500. There'll be ketones in the blood, and then you diagnose them based on this. And then we have some antibody testing to do. We do these things and then we diagnose the type 1 diabetes. In the type 2 diabetes, usually symptoms are very minimal at the early stage of diabetes. So main diagnosis is usually through routine screening. Many people undergo routine screenings, routine health checkups, and then diagnosed with diabetes. But at a later date, they do develop symptoms. So the first would be increased thirst, increased urination, and then increased hunger. So these are three things which are labeled as symptoms of diabetes, but they usually happen at a much later date. Initial would be no symptoms. So sugars will be high. They might be mild fatigue. They might be feeling little tired. They don't know the reasons. And then other common symptoms which we usually see is some infection which is not getting healed, feeling especially tired and everything is normal, and people getting genital infections which are not coming down. So these are the few other common symptoms which with which people come to a clinic and then they're getting diagnosed with diabetes. Diabetes can cause multiple complications. This is the first reason why we have to treat diabetes. Many people think it's all about the numbers, bringing down the sugars, but it is not. It is not just a number game, or we are not chasing the numbers here. So diabetes itself, why are these numbers significant? Like I said, 126, 200, or HbA1c 6.5. Once these numbers are crossed, there are some changes happening in the body. So these high glucose cannot be regulated in many of the organs. So if the sugars are high, some organs receive high increased glucose flow into these organs, and which is not regulated, and these can undergo damage at a later date. So one of them is eye, then the nerves, then the kidney. So these are three things which usually get affected in diabetes. So one is called diabetic retinopathy, then the other is called diabetic neuropathy, and then the third is called diabetic nephropathy. These are called microvascular complications of diabetes. Apart from these, there can be lipid abnormalities, which also lead to increased risk of cardiovascular diseases like heart attacks, heart failures, and then there is increased risk of cardiovascular diseases like strokes, paralysis, and then peripheral vascular diseases causing ulcers, gangrenes in the foot. So these are called macrovascular complications of diabetes. So in broad, we have two complications in diabetes. One is called microvascular complications, the other is called macrovascular complications. These are the complications with diabetic patients, which if they are uncontrolled over a long period, will likely to develop, and most of these are preventable if your blood glucose levels are within the limits initially for at least 5 to 10 years. There is a good scope to bring all these complications down. Diabetes management is broadly divided into MNT, which is called medical nutrition therapy. Then it is followed by medications, oral drugs, then into injectables. So first category, as we said, MNT, which will be continuous throughout the course of diabetes management. It is not limited to initial stages. So initial stages can always be reversed. So diabetes, when it is diagnosed, if your sugar values are high, if you're doing your diet properly, exercise properly, definitely the diabetic values can come down to normal, can even be reversed, and that is definitely possible. Diabetes is a progressive disease. So the day we know we're diagnosed with diabetes, 80% of your pancreatic capacity is already decreased. So they say around 50 to 80. So given the range, so we are only left with 20 to 50% of pancreatic beta cell mass to live for the rest of the life. So how we manage this will be the most important thing. So rather than whether to go with drugs, whether to go with diet, the most important thing everyone should remember is the blood glucose levels has to be in control. If that is in control, whatever doing, that is 100% good. But if the values are not under control, definitely you need to change your management. In type 1 diabetes, as I told, insulin is only the treatment option. They don't, there the drugs don't work. We have to give them insulin from the day one. So then coming to type 2 diabetes, I think insulin is the last resort, but it can be used in multiple levels of diabetes regarding multiple conditions. Suppose, say, the person is undergoing a surgery, so oral drugs will be stopped. They might be put on insulin for a temporary period, and then they can be stopped again once the surgery recovery is done. In the same way, there could be some infection in the body which requires healing, and then control of sugars at an earliest. So in those cases, insulin helps in not only controlling sugars, but also recover from the injuries or the healing process or those sutures. So in all these cases, we do give insulin. And then once the process is complete or once the recovery is done, we usually taper them off the insulin. But at the in type 2 diabetes, we are only left with 20 to 50% of the pancreatic capacity. So when the pancreatic reserve completely falls or almost near to failure, so we need to start insulin at an earlier date. So this is a very clinical decision. We have to see on what medications are there and how much control is happening. So if the control is not really good, or you know that they might fail within 1 to 2 months on the oral drugs, so we should start preparing them for insulin initially, and then once the time comes, we need to start them on insulin. So I think today's things are changing. People who are on insulin like 3 4 years earlier, with the advent of new medications coming, many people are off the insulin and again back to oral drugs. So we don't know there are a lot of newer drugs coming every 1 2 years, and then there's a lot of change in the diabetic medications. So don't be afraid of insulin. Control your sugars well. So even if it requires insulin, take it. So whenever the newer drugs come or some new technology comes, we can always remove your insulin. But if you develop complications, that will be a little task, and then taking care of the complications is much tougher than taking insulin. So I think initially, if the sugars are uncontrolled, we usually give a course of medications for some people at 15 days, for some people at 1 month. So usually 15 days to 1 month, if your sugars are uncontrolled, you need to check and get back to your doctor. And then based on the control, whether to increase the dosage of medication, decrease the dose of medication, those things are taken care. And then once the sugars come to a pretty decent level, or say when your doctor is confident that your sugars are well controlled, maybe then you can monitor once in a month at home and then visit your doctor once in 3 months. That will also be fine. But as a general rule, visiting your doctor once in a month will help you in the long run. Initially, they'll be coming, but once the control is there and they see it is not changing really much after 2 to 3 months, they stop coming to the clinics or they stop checking later on. So if they're not coming to the clinic later on, it will they'll not even check, and then what we see, this will lead to in 1 to 2 years of not even checking your sugars, and then suddenly you check and it is 250, 300, and then again you come back to the day one. So if you don't want this to happen, you need to be regularly in touch with your doctor. If it's well controlled over 3 to 4 months, then we usually advise them to come in 1 to 2 months or once in 3 months. We motivate them to keep the diet in regular check and then exercise patterns to keep in check. So if you're missing on your regular visits, then slowly you're gonna lose that diet, you're gonna lose that exercise, and then you're gonna fall back to your old lifestyle and everything. So more than changing of drugs, everything, I think it is your it helps you in motivating and keep you in the right track, and also it helps the doctor identify at an earlier stage that you might have increased sugars in your next visit. And so before even increasing, we can change the medications in this visit so that you will not even have even one episode of high sugars during your course of control, because this is a long-term medications are required and long-term checkup and controls are required. So if you lose your 2 to 3 years in an early stage, and that can be a real worrisome. So there is something called glycemic memory. So bad glycemic memory can happen in the body. So body remembers how long you have been uncontrolled, how high the sugars are, and then these are not changeable.